Now for today's topic. Deficient emotional self-regulation is the inability to regulate responses to certain emotions and to avoid overreacting to life situations. But it is excluded from the DSM-V diagnostic criteria for ADHD, even though it has serious negative effects on a person's daily functioning. Everything from a greater risk of having a car accident, to never being married, to having a lower quality of life. In addition, DESR, as it's called, may worsen other ADHD symptoms and plays a part in several comorbid disorders, especially oppositional defiant disorder. Dr. Barkley will discuss how to determine which aspects of emotional dysregulation stem from ADHD or a comorbid condition. He will also outline the best approach to diagnosing and treating DESR. Dr. Barkley is a clinical professor of psychiatry at the Virginia Treatment Center for Children and Virginia Commonwealth University Medical Center in Richmond, Virginia. He is a clinical scientist, educator, and practitioner who has published 23 books, rating scales, and clinical manuals numbering 41 editions. He is the founder and editor of the bi-monthly clinical newsletter, The ADHD Report. His websites are www.russellbarkley.org and adhdlectures.com. You can ask questions of Dr. Barkley during his presentation, and we will try to get to as many of them as we can after he is done. So with all that being said, I'll turn it over to Dr. Barkley. Thanks so much for being here today.
Yes, thank you so much, Wayne, and you too, Lily, for helping me out today. I'm going to begin with an apology, very unusual for me. I am recovering from 9 rib fractures that I had in a car accident about 2 weeks ago. So I'm going to have to stop more often than I normally do to catch my breath a bit. And that's also why you see me a little bit facially disfigured with some pock marks up here on my forehead. But I didn't want to cancel this program because I thought it was important, and also because of the large number of pre-registrants that we had. So bear with me and try to teach you something about what I believe is an extraordinarily important but overlooked component of ADHD, and that is the problem with impulsive emotion coupled with difficulties with the self-regulation of strong emotions once they're provoked. I'm not going to have time to cover everything on every slide, but I wanted you to be able to take these away when you download the slides so that you have more detailed information. Very quickly, in case you don't remember Psychology 101, an emotion is a change in our intentional and motivational stance toward the world. Usually involves also a change in our subjective experience. Has 3 components, essentially. There's a behavioral component, whether we're going to approach something or withdraw from something. Is it a threat or is it desirable? That leads to the second. There's a motivational aspect to emotion, a reinforcement punishment aspect. Do we feel pleasure or pain from the event that provoked the emotion? And then, of course, there's a physiological component, which is the degree of intensity of the emotion that we experience internally. So emotions involve all 3 of those things. But the most important point to make here is that emotions in all other species are provoked by environmental events around them. And in that sense, emotions are sort of a very primitive form of communication of that organism to other organisms about a change in its state at that time. Humans, on the other hand, as we will see, have a second part to their emotions, which is the ability to self-manage them and even provoke their own emotions. But keep in mind, most of the time, our emotions are being elicited or provoked by events around us. Now, when we think about emotional self-regulation, and Lily, I find that the slides are not advancing here for some reason. There we go. Thank you. We think of emotional self-regulation as involving at least 4 or more steps or components in the process. The first is the capacity to inhibit the strong emotion that's been provoked by something around us. The second is that we then try to calm ourselves down, to self-soothe and down-regulate the emotion if it turned out to be something that's very upsetting to us, sort of one of the negative emotions. And then what we try to do as well, often simultaneously, is to refocus our attention away from the provocation. By interrupting our attention to the event, we can often downregulate the emotion much faster than if we keep paying attention to whatever it is that's bothering us, that is provoking this emotion. So, and usually refocusing involves not just distracting yourself or looking away, but may also involve a cognitive type of refocusing where we reappraise and reevaluate the event in our mind as to its real importance versus what has been provoked in us. And then finally, humans organize new emotions. They modify the emotion they're experiencing, and they may even be able to substitute a different emotion, a healthier emotion, one that's more consistent with their goal in that situation and more consistent with their longer term welfare. So it's quite a complex phenomenon, this inhibition of emotion coupled with the self-regulation of emotion. And beginning about 10 years ago, I began to argue that this is precisely what was missing in ADHD and had been for some time. Now, if I was correct, if emotion is central to ADHD, then what would we expect to see? We would see that part of ADHD isn't just hyperactivity or impulsive words or impulsive motor actions and inattention and distraction. There would also be impulsive emotion. The emotion that an individual experiences would come up very quickly, much more strongly than in others, because they're not suppressing and inhibiting and moderating it. And although this is true of all emotion, levity, humor, affection, and so on, it's especially problematic with the negative emotions of impatience, frustration, hostility, anger, and even the propensity for reactive aggression when we get upset. All of these would be expected to be more common in people with ADHD, but what would be especially problematic for them would be control of the negative emotions because they are more socially costly than the positive emotions would be. It's okay to be a class clown. You might even be able to make friends and to be a little more silly and aroused and talkative at a party. But it's not okay to express your frustration and anger and hostility so quickly toward other people. That's inexcusable. So that is why we see that people with ADHD have difficulties in their social, occupational, family lives, and elsewhere having to do with the expression of strong negative emotions. But also, we would expect that they would have difficulties with grappling with the emotion. Once it's elicited, can they engage in those top-down executive strategies that we use to try to moderate and quell and make the emotion more acceptable to that context and better off for us in the long run as well? And people with ADHD find it difficult to do that also. Keep that in mind, by the way, because it tells you that it's going to be difficult to entrain this through a skills training program with someone with ADHD because of this basic executive deficit in emotion regulation. Now, just as an aside, I won't dwell on it, because emotions are part of our motivation and give us self-motivation, then we should see that there would be problems with motivation in people with ADHD, procrastination, difficulties with starting and finishing work. They can't sustain their activities as long as others in the absence of external consequences that are immediate and motivating to them. Internal motivation, self-motivation, is quite weak. So that's what we would speculate should be involved if my point here is true, that ADHD does involve problems with emotional self-regulation as a central feature of the disorder. Now, I'm going to prove to you that it is part of ADHD and show you why it is such an important component in understanding and conceptualizing the disorder and in helping to diagnose and manage it. So very quickly, I'm going to go through the history of emotion in ADHD, the neuroanatomy, the neuropsychology of the emotional problems in ADHD, evidence from psychology that impulsive emotion is absolutely a part of ADHD. And then, of course, I'm going to help you see why putting emotion back in ADHD explains several of the major comorbid disorders that will arise over time as a result of these emotional control difficulties. And one of those, the most common in children anyway, is oppositional defiant disorder. But I also want to show you that the emotional aspects of ADHD predict a whole slew of impairments that we can't understand from simply the traditional symptoms of ADHD, the attention deficits and the hyperactive impulsive behavior. They can't explain these additional impairments, but the emotional disturbance can. Finally, I'm going to show you how putting emotion back in ADHD helps us with diagnosis and with management. So buckle up, sit tight. We're going to take a real quick ride here in the 30 minutes I have remaining to